morning and good afternoon. My name is Kayla Edmonson, and my presentation will focus on the topic of sexual attractions in the client-therapist relationship. Researchers have questioned whether sexual attractions are to be expected within the therapeutic setting. In 1986, Pope and colleagues conducted an experiment which addressed the lack of systematic research on the topic of sexual attraction between therapists and their clients. The results for this research experiment can be viewed within the chart displayed below. The information described and discussed within the previous slide has presented the fact that counselors and therapists have a difficult time accepting and recognizing their sexual attraction toward their clients. Newkirk and Milliken in 2011 conducted a survey which reported that 10.3% of counselors believe that it is ethical to express their sexual attraction toward their client, whereas 89.7% of counselors believe that it is unethical to express their sexual attraction toward their client, which can be viewed within the chart displayed below. Training programs have an ethical obligation to discuss concerns associated with sexual dilemmas in the therapeutic setting with students. Trainees and students should be equipped with the abilities needed to manage sexual dilemmas within a range of settings, such as an internship. There are several suggestions for dealing with sexual attractions. It is important for experienced counselors and trainees to question how to set boundaries when sexual attractions occur. For example, professionals who have a hard time establishing clear boundaries within their personal life are more likely to encounter problems when setting boundaries with their clients. Within the counseling and therapeutic environment, sexual attraction toward clients can be recognized as an inappropriate behavior due to the client-therapist relationship. Barnett stated that counselors and therapists establish relationships of trust with those with whom they work. For example, clients share different forms of information with their counselors, which could include their insecurities and vulnerabilities, as well as information they have never been able to share with another individual before, with the hope of receiving assistance. Boundaries help provide a foundation for the relationship between a counselor and an individual, which then fosters a sense of safety and the belief that the counselor will always act in the same and best interest of the individual. Boundaries could include location, time, interpersonal space, self-disclosure, touch, and gifts. Multiple relationships can be recognized as a scenario where a counselor or therapist has engaged in one or more additional relationships with their client in addition to the treatment-focused relationship. These relationships can be non-sexual or sexual. When coming to prevention, counselors and therapists should be cognizant of their own emotional needs and functioning, mindful of the powerful differential in the professional relationship, and careful not to abuse the trust and dependence of their client. There are several ways in which sexual attraction could occur between a therapist and a client, such as the process of role trading, which is when the client assumes the role of the counselor and the counselor assumes the role of the client. Therapists and counselors should be aware of the harm that could take place within activities such as role trading, as well as accept that the counselor and therapist has the responsibility to ensure that sexual intimacies and attractions with a client do not occur. Therapists and counselors should also be aware of the power difference between themselves and the client. Issues of sexual dual relationship include prevalence, harm inflicted on clients, predictability, and parameters for concern. Counselors and therapists in practice have an obligation to become informed and aware of issues related to sexual dual relationships, whether the counselor is in a private or public sector. Education programs which focus on the topic of sexual dual relationships are of extreme importance. Training strategies should include knowledge, self-awareness, and a program climate which encourages value development and appropriate faculty behavior. This training program should provide a safe environment where individuals could address and discuss their sexuality and sexual attraction. Counselors and therapists must acknowledge that they are in a power position, and with that position comes the potential to influence clients. The ethical training model emphasizes the importance of the learning process of ethical reasoning and decision-making. The goals of this model include the sensitization of counselors to ethical issues, the improvement of counselors' abilities to make ethical judgments, the encouragement of counselors to use responsible ethical actions, and the toleration of counselors to use ambiguity when using the process of ethical decision-making. Counselors and therapists should be sensitized to the ethical issues regarding sexual attraction within the client-therapist relationship. Several prevention strategies have been initiated, such as the development of self-awareness. Counselors and therapists should be aware and be able to address their personal sexuality, power, and legal needs, as well as program climate, which could be recognized as an atmosphere conducive for learning with competent and informed issue of sexual attraction in the therapist-client relationship can be associated with several different ethical codes, which include the ACA, APA, and NPCC. These different ethical codes presented below describe the fact that counselors and therapists should not engage within sexual relationships with their client or individuals that have had a relationship with their client, which could include family members, for a period of 5 years following the counselor or therapist's last professional contact. There is a recurring theme within this presentation that focuses on the fact that counselors should use their knowledge, self-awareness, and program climate in order to understand the factors that influence sexual attraction in the client-therapist relationship and how these factors could affect both the helping professional and the client. While much of the research presented and provided on the topic of sexual attraction in the client-therapist relationship has focused on the use of training and prevention techniques, it is important to recognize and evaluate the fact that sexual attractions do occur and that there is always a need for more research on these topics, especially within the counseling and therapeutic field.